new therapies, replacement organs, and diagnostics has transformed medical care in the new millennia. This change is driven by new technical, market, legal and social drivers. The manner in which pharma solutions are being made is greatly different than pharmaceutical products developed in the 90s, just a few short years ago. These changes are beneficial for our patients but are disrupting the time-tested manner in which pharmaceutical solutions have been produced. Pharmaceutical therapies once based on monomer chemistries are now increasingly based on 4 or 5 differing new root technologies that are now impacting the field. Further, the Bayh-Dole Act, other changes in IP law, fiscal realities of drug development, and regulatory change are often beyond the resources of any one firm. How are firms managing pharmaceutical product development? The industry's answer is traditional technology road mapping. But the new nature of pharmaceutical solutions preclude it. The industry and its firms need a new road mapping technique so we can produce better products faster, cheaper and with less risk. Let's ask Mansev.
Thanks, Doctor. We have developed second-generation techniques before for disruptive single-root technology solutions. But this situation requires a third-generation roadmap effort. Let's see how this new type of roadmap or technological landscape will help a firm and the industry embrace 21st century pharma development.
This is difficult. We have 3 other labs like this one making part of our solution, and we simply do not know if we are choosing the right technologies or partners. Can you help us?
Thank you, Sam. Let's look at how your industry has changed. First, the Bayh-Dole Act of 1980 changed ownership of IP developed with U.S. governmental money to the researchers. Then biology, with companies like Genentech started providing solutions superior to those based on chemistry alone. This was followed by solutions based on MEMS, nanotech, computational sciences, and advanced chemistries. Further, these solutions were often based on more than one technology. Moreover, the cost of drug development reached nearly $1 billion, and often based on technologies traditional providers knew little about. Am I correct?
You are. And that is a risky proposition for us. Moreover, our regulations in general, how we as a pharma supplier could interact with the customer has changed.
I have noticed that the industry traditionally had few consortia and now you have well over 100. Our team of pharmaceutical technical regulatory and legal professionals see this not only as using open innovation techniques in a manner to disperse financial and technological risk but also as a new business model.
You are right. We still have our own internal developments and strategic alliances, but we use consortia as an expanded partnering technique and much more.
Our technological landscape technique can be used for your internal and strategic alliances as well as consortia. It is based on the 21st century pharmaceutical solution. We need to use the elements where we can from the first 2 generations of roadmaps. We need to include the unique nature of pharmaceutical solutions. Our third-generation roadmap is based on our 5 root technologies, driven and bounded by regulations, market drivers, technological drivers, and legal drivers. Instead of the technology learning curve, which would require a discrete technology pathway, and look like a Moore's law graph based on a single critical dimension, we have used a technology readiness level generated curve based on all attributes of all root technologies required by a consortia or internal product development effort. Pharmaceutical technology road mapping is not as direct as it once was. Traditional technology road mapping practice falls short of today's need. Mansev has a better solution.
You are right, we have gone from a traditional single technology-based product to a multiple technology-based paradigm. Differing regions incentivize us to develop and produce. When we were chemical-based industry learning and translation of the learning into firm-based strategy was direct. Now, it seems the common industrial learning portion is gone.
You are correct if the industry uses first or second generation road mapping techniques, but the industry players are collaborating through consortia and open innovation. This creates cross-firm or industrial learning. This advances the industry.
Yes, I see that, but the industry is changing in other ways with a myriad of drivers and bounds. How can learning take place?
The nature of the entire industry must be represented in the road mapping techniques used. Here we provide the drivers in the top level and the consortia in the second tier. The second tier is the development over time of differing industry components. The first or bottom tier is the 5 technology-based pharmaceutical solution set as it matures.
I see, you use some elements of traditional roadmaps, replacing dominant products with industry consortia. What do you use instead of technology curves like Moore's law?
Due to the lack of a critical dimension or unit cell in multiple technology use, we use the entire set's technology readiness level and generating its progression over time.
That sounds interesting, but can you show me what it looks like? This is very usable, but as we previously discussed, how can I use this tool to help me choose which regional consortia to work with?
Many say to follow the incentives, but our pharmaceutical landscaping committee did more. Here we show the results from the top investing nations in nanotechnology. We show outputs from a variety of nations in terms of scientific and technological publications, patent development, and most of all product generation by dollars invested in PPP, or purchasing power parity. We further provide a technique that can predict the outcome per investments in terms of publication, patents and products for any country.
That's great. Can you tell me how to develop a technology readiness level curve and just what are the drivers and bounds in the industry?
Yes, we can. But that is all in the pharmaceutical landscape, and we ask you to buy it here to receive that knowledge. We know that it will be insightful and you will benefit from the more than 50 strong Manseft members that have dedicated their effort over the last 4 years to provide it to you.